Hello, everyone. I'm Sheldon Barlett-Rumor, and this is it. Welcome back to This Is It TV. I always look forward to these segments with my dear friend. I'd love for him to reintroduce himself, his first and last name, and all he's up to.
Sheldon, I'm Louis Bezich, men's health advocate, contributing writer to phillyvoice.com, and of course, the author of Crack the Code, 10 proven secrets that motivate healthy behavior and inspire fulfillment in men over 50.
Oh, I'm so good. I'm so good. And you know, we cheat a little bit and we always touch base about what this is about. And I'm super excited about this one. A little surprised, to be quite honest, on some of the research that you've gathered. And I want to dive on into it. So what are we talking about today?
Well, today we're talking about what I call the 1-2 punch to men's health. Last time we were together, I was ranting about a Commonwealth Fund report that said that U.S. males have higher rates of chronic conditions, higher rates of avoidable deaths, and a greater need for mental health services compared to men from other affluent countries. And to me, that was like, almost like a kick in the groin for a men's health advocate. It wasn't good news. We're still headed in the wrong direction.
Absolutely not.
Unfortunately, that was punch number one. Punch number two came just a month later when the CDC, Centers for Disease Control and Prevention, issued their life expectancy report. And guess what? While it wasn't good for Americans as a whole because life expectancy is going down, now that's influenced a great deal by COVID, but embedded in their reporting was the fact that the gap in life expectancy between women and men has grown to just about 6 years. So, we've always been lagging behind women. We catch up a little bit, but now it's greater than ever. It's the greatest, gap since like the 1920s. And it's not a good thing. And
it's not a good thing.
Yeah, I think we need to kind of redouble our efforts and maybe look at things a little bit different and frame it differently to the men and the people that love them out there.
Right. I mean, first of all, I had no idea that it was that large of a gap. It's kind of this running joke that, women are going to outlive their partners, outlive the men in their lives. Yes. But I didn't realize how extensive that is, that number, close to 6 years. That's a long time. That is a long time. And I know you've done the work. You've put together, what these men should be doing, what we all should be doing to live healthier lives. Where do you think the disconnect comes in?
Well, I think that I'll go to the men that I've studied that do lead a healthy lifestyle to figure out like where does their motivation come from, and they connect the dots. They understand that leading a healthy lifestyle is not the end game. It's a means to the end, right? It's something that you do so that you can enjoy the benefits of a healthy lifestyle. And I think we need to reframe things that way to suggest to folks like, hey, if I showed you a way that you could sleep better, build your testosterone and have a better sex life, reduce the likelihood of disease, build your immunity, have better relationships. I mean, there's a whole host of things that healthy behavior gets you. And I think if we can stress sort of what I call the value proposition, we have a better chance of getting folks to adopt healthy lifestyles, because there really is a dividend to be paid.
There is a dividend to be paid. The benefit is living longer. The benefit is seeing all of your loved ones and participating in the life that you have created. I think oftentimes just in the fitness journey in general, or fitness and wellness in general, people think these have to be drastic changes. And don't get me wrong, I think that there's a lot of people that need drastic changes. Sure. But for a lot of what we've talked about, over and over again on the show, as well as the things in which you advocate for, these are just small, slight lifestyle changes that people can make. It doesn't have to be complete life transformations right away, at least.
Absolutely. What I tell men all the time, and again, women and the folks that love our men, is that start small. If you have a strong why, if you have the purpose and the rationale and the reason to live healthy, you can fit it into your schedule, right? Because we always hear, oh, I don't have time, I can't do it, blah, blah, blah. Well, you make time if it's a priority. So number one, again, have the rationale and give it some thought to why it should be a priority, and then you can work it out. And again, you're right on point. Start small, just a couple hours a week, walk around the block,
Yeah.
Put down the fork when it's appropriate. If you do the gym membership, just a little bit, a couple times a week, and build it up. It doesn't have to be, to your point, it doesn't have to be drastic.
Yeah. And we always say on the show, you don't know what you don't know, right? And I think we become creatures of habit, right? You're eating the same thing, you're rushing around. And I think we were all, to be quite honest, I mean, this even happened to me. Pandemic was one of those situations where I got myself into a routine. I had the extra time. I was working out in some cases twice a day, like doing various things and staying active in my home. And then I found myself getting back into the minutia of the hamster wheel that I promised that I would not get myself back into.
Right.
And so the excuses, not enough time, gym memberships are expensive. So when people say those things, I'm sure you remind them, of course, of the end game, but what are the other pieces of advice you can give to keep us on track?
Well, again, it's healthy behavior, I always say, is a team sport.
Yeah.
You increase your chances of sustaining that healthy lifestyle if a spouse, if children, adult children in particular, or whomever, a buddy, friends, if you can get some support. We always need a support network. We're social beings. So the extent to which we can have others that, on those mornings when it's tough to get up, somebody's there to help you. And conversely, you're there to help them. And together you can go on that journey, and it really increases the likelihood that you'll stick with it.
I love that. I love that. I think this is so informative. I don't think that people, I think that the fact that you provided that there is a 6-year gap, right? Especially for those of us that really are goal oriented and also really enjoy our lives. We want to be able to live our best lives, not deprive ourselves of joy or food or things in which we like, but utilize these benchmarks that you're providing in order to live a longer life.
Absolutely. And it's also not only living longer, but the quality of your life.
Quality.
Can't ignore that, because it's not just quantity, but it's also quality.
Right, right. I mean, I don't think that we even think about that as much as we should, right? Like, I think we've talked about on the show before, just being okay. Like, if it aches, if it's not feeling well, if your digestion isn't good, like, don't just suffer through that.
Right. Get some care. Men obviously are notorious for not seeing the doctor, not getting the preventative measures. You don't have to wait till something hurts.
Right.
At least get your annual physical as a starter.
Oh, I love this. I love this. You are always providing clear insights as well as proper advice. I'm spoiled to know you. I'm spoiled that you're part of our network and everybody gets to learn from you. If people would love to learn more about all that you have going on and get their hands on that book, where would they find that information?
Look right over my shoulder, 50plusmen.com. Find out everything you need to know about what's going on in my world and how you can get engaged in advocacy for better health for men and women of all ages.
Oh, I love it. No excuses, folks. He has all the information that you need. I suggest you follow, fan, and like my dear friend. Thank you so much for joining me.
Thank you. Loved it.
Of course. We'll see you next time from all of us here at This Is It TV. I'm Sheldon Bartlett-Rumer, and we will see you soon. Take care.